Welcome to the official Dys Dyvas podcast, where two friends with dysautonomia decided to ditch their salt and vinegar chips for a support group that's the perfect blend of sass and self care. Join us for some serious belly laughs and a healthy dose of sarcasm as we navigate the ups and downs of chronic illness together. Ladies and gentlemen, I present to you the Dys Dyvas.
Hey.
Hello, Diva.
Hello, Diva.
How are you doing today?
I'm doing good. How are you?
Doing well. Thank you.
I have something I want to show you. If I can get it on camera.
I'm the little bow tie.
Yes, his little bow tie.
Who is that?
He doesn't have a name, and because he's an alpaca, just similar to a llama, but I wanted to use him for our show today because we're going to talk about drama llamas. And the cuteness of his little face is also a distraction.
He's very llama stay.
Yes, he's so cuddly. He came all the way from the Netherlands, and he's made from alpaca fur. Anyway,
Aww.
back to the drama llama subject. I'll stop playing with him because he's very cute.
I'm excited about today because people are like, what the hell are these two talking about?
Yes. And I'm all brightly colored today, taking care of all the chakras.
Let me see your t-shirt because I can only see half of it.
I have a mandala.
Oh, wow. Is that a cross? Hold on. Is that a cross?
No, it's actually part of the shirt.
Oh, my God. It looks like hanging. I love it. Wow. Very cool. Very, very cool. Love it.
Thank you. Being all colorful. A hippy dippy day.
I love that. It's Hippy Dippy Friday.
Yes.
What is a drama llama? So I remember this like it was yesterday. The stupid disease that you had when I first met you, I'm like, what the hell is she talking about? I couldn't even pronounce it. And I was like, dysauto what? And I'm like, dysauto llama, nama, whatever I said, I could never pronounce it. Probably until I actually got diagnosed with it. And I remember you were always like so sick and I couldn't understand what was happening. What was happening? So for you, what is a drama llama?
A drama llama, for me, this is when my autonomic nervous system goes a little wonky. Basically, because I have hyperpots, which is a form of dysautonomia. There are several other forms. But hyperpots is my lot in life, where I will get these severe adrenaline surges. My heart rate will increase, my blood pressure will increase, I get lightheaded, I get dizzy, I start shaking, and a lot of times I get really short of breath. So, and when these things all combine together, it's like the perfect storm. Yeah. You literally can't do anything. Whatever you're doing, you have to stop. So for me, when this starts to happen, I have some rescue medications that I take. I have a hyoscyamine sublingual tablet that I put under my tongue, which is to help calm my vagus nerve. That's followed by a lorazepam, usually, or Ativan, whichever I prefer. And then I check my blood pressure, which is usually sky high. I have gone over 200 before, and take a clonidine. Then it's immediately assume the position of lying down, elevated back, feet elevated, and I usually put an ice pack in the back of my neck because there's a cluster of nerves at the base of your neck that are helpful as far as trying to control the vagus nerve. And basically, you kind of got to wait it out, even if you're shaking and you can't breathe. And I do have oxygen to supplement if I need it, which I do tend to need it. And that's how I handle mine. How do you handle yours?
Well, now that I know what I'm dealing with, it's so funny because you gave me so many tips and strategies, like, get in position, feet up, ice pack on your vagus nerve, don't move. But before I really knew what it was, I just ended up in the ER and just hearing another doctor telling me a friggin' anxiety. And I'm like, I'm namaste as fuck. Come on, people. I'm not anxious. So now I'm learning to navigate it. I'm learning to kind of right when they start, I'm able to nip it. So instead of going into like my blood pressure going all over the place, I'm able to do a little meditation, a little more mindfulness before it gets too far. Because once it's too far gone, I have to go to the ER to get stabilized. And I'll never forget it was last year when I was in the emergency room, and I was in the ambulance and I called you. And when I get my drama llamas, I either go anaphylaxis, I can't speak, and I could not talk at all. And I'm in the ambulance and I'm like, talk to them, Christine, talk to them, Christine. And when I got to the ER, they were so rude to me that I was like, thank God, because you were able to say, look, she has dysautonomia. Is there a doctor? Because I could not speak for myself. And since I went in the ambulance, Kenny hadn't gotten there yet. That was a nightmare. Like that was probably one of the worst experiences, and this happened last year. So
that's really scary.
Crazy.
And like the question, at what point do you seek medical attention? That was your breaking point because it had gotten out of control. So for each of us, we have a certain level that we get to. And if your base protocol that your doctor gives you doesn't work for you, and you're in this for at least over an hour and things aren't getting any better, they're getting worse, or something different and drastic is happening that's never happened before, that's a cue that you need to go to the ER. I know you don't want to go to the ER. Nobody wants to go to the ER, but it could very well be something else that's triggering this episode that medical professionals need to help you with.
Yeah. So with the dysautonomia, I mean, we're explaining to people that it is a big umbrella, right? There's 15 different varieties. Yes. I know I have hyperpots and I have inappropriate sinus tachycardia, which is how mine first started. And then it turned into dysautonomia. I got more diagnoses last year. A lot more diagnoses last year. Are you finding now that you're like a pro at the Drama Llamas, like you're able to stay out of the ER a little bit easier now, or it just depends?
I think it's better. I mean, absolutely. The last year that I was able to work full time, it was crazy. I'd gone to the ER 34 times. No joke, 34 times.
That was the year I met you. I
cut that down. Yeah, I mean, it was constant. And what would happen is the stress from working was triggering a drama llama. But I didn't know that at the time. And it's very scary. If you've never, ever had one of these before, sometimes you feel like you're having a heart attack, you can't breathe, and you just don't know what's going on, and you're terrified. Mm-hmm. But then, mysteriously, your body calms itself down, and then everything goes back to normal. Sometimes it could be 20 minutes, an hour, 2 hours, 4 hours. Some people go on in these situations for days. I could not do this for days. I would have to get assistance. But if you're able to find the right provider and get your emergency kit ready, I mean, I always carry it wherever I go. I've got a blood pressure cuff. I've got a pulse ox. I've got a hot pack, instant hot pack, instant cold pack, and I've got my emergency meds ready to go. So if we're in the car, if we're in a restaurant, wherever we happen to be, even if it's a theme park, whatever, I've got my rescue kits. And as a matter of fact, a week ago, we were at a theme park, at a hotel, at a very large theme park. And I woke up and my blood pressure was like 200 over something, and I had a pounding headache, and I was like, what's going on? I took my medication, had everything, even had the oxygen, and was still able to bring it down. But it took so long for it to go away that I actually had a paramedic consult. And they came in and they were like, yep, we see POTS quite frequently. We think that this is starting to be on the downward spiral, so you're doing better. If you want us to take you for treatment, we will. But if you want to just rest, but continue to put your feet up, the ice packs, the whole 9 yards, and see what happens. And that's what I did. So have your go kit ready, and and have someone with you too. That's very important. Have someone that's with you, or someone in your family that knows exactly what a drama llama is and the issues that you can have. Like you had the issue where you can't even speak. With the medication I take, my mouth gets so dry I can't talk. So by the time you get to the emergency room and you're trying to explain to them what's going on, they think you're having a stroke, because you can't talk. And I'm like, no, I just need something to drink so I can tell you I'm not having a stroke, or ask them for a pen and paper or something so you can communicate with them if you can't have somebody there with you. Or like Stacy did, dial somebody that knows what's going on and hand the phone, put it on speaker, say, I'm having a drama llama. Can you talk for me? And then explain to paramedics or doctors what's going on. And then let's see, how do we deal with a doctor that downplays our drama llama? Do you want to answer that first, Stacy, or would you like me to answer that first?
Well, you can answer that, but I just want to say something real quick. I think we'll definitely do an episode and give people the tips for like a rescue bag, and maybe like a binder or a folder, just some really good tips. So that'll be an episode in the future, kind of like to prepare everyone who has dysautonomia or mast cell or any real chronic illness. You need to be prepared. But yeah, you can go ahead and answer that one first.
Well, first of all, for a doctor who downplays a drama llama, I have not a lot of respect for them. I try very kindly while I'm struggling to breathe to explain to them that this is what's going on with me. I recently had a doctor who thought it was very funny when I was in the ER and I was literally struggling to breathe to the point where I was hunched over on the bed. And this doctor came in and said, "Oh, how are we feeling today, Mrs. Potts?" She thought she was being really funny. That escalated into me asking for the charge nurse because I was trying to explain to the doctor what was going on. She was obviously not familiar with my symptoms for POTS. And I explained to the charge nurse that this doctor was actually not helping me. I was there to be helped. I was not getting the help I was needing. I was getting significantly worse minute by minute. And then if I wasn't able to get her help, I was just going to take my own pills and medicate myself and sign myself out of the ER. The charge nurse came in, was very apologetic and said, "Yes, do what you need to do. I'm so sorry." But just, you kind of have to be prepared because you're either going to get a doctor who is very familiar and you're going to be like, "Oh, thank God, you're amazing. I love you." Or you're going to get someone who just thinks that they're a comedian and doesn't understand. And you have to be your own advocate. You cannot just let them make you miserable, go above their heads. And at this point, I was still having trouble breathing at that point and trying not to pass out. So, and that was aggravating my symptoms more because I'm mad, more adrenaline. So you just have to still be your own advocate. And my husband was there. He knew what was going on. And he was running out, getting people in the hallway, trying to get him back in the room. But don't let him get away with it. And after you leave, make sure that you contact risk management with the hospital or whoever you need to talk to, a manager, and just explain the situation that you went through, because nobody should have to go through that. You should all be taken seriously. And that's what they're there for. They're there to help you, not make you worse.
Right. It's really hard for me coming from Western medicine. As you know, I was a nurse for 27 years. Due to my disabilities and medical PTSD, I had to leave the profession, which I'm fine with. But I had a situation. It was actually the last time I was in the ER. So that was probably a couple months ago. And again, I could not speak. I had one of my friends with me to be my advocate. Kenny was at work. And she basically said, I think she said, "What do you expect us to do for you?" Okay. And I said, I don't remember what I said because I really couldn't talk. And then she had the audacity to say to me, "Well, it looks like you're having severe anxiety. I would suggest you going to the psych hospital." It took all I had not to slice her and beat her. And I'm like, "You're too pretty for prison, Stace. You're too pretty for prison." But it was the first time, and understand the last 3 years, I have been so gaslit. Like, I'm still traumatized. It was the first time I wrote a letter and I said, "This is disrespectful. This is unacceptable. And who is she to diagnose me?" You know, and I was furious. But I also have had so many bad experiences that when it comes to me going to the ER, I go in already having too much knowledge. I know too much. I know what they could do if they wanted to do and they weren't lazy. So for me, every time I go to the ER, I have to be completely prepared, composed, but good luck having a drama llama and trying to maintain composure.
Right. Yeah.
Wow.
Sometimes you but yeah, it's very, very difficult, especially when they're not responsive, and it's not a joke. I know the doctor that I dealt with thought she was being funny, and I'm like, no, this is not funny. I'm struggling to breathe. My heart rate is high. My blood pressure's was almost 200 at that point, over like 120 something, and she wants to play games with me. And I'm like, I'm not going to stroke out because you think this is fun and games.
Yeah. Yeah. You know what I would like people to do? I would like people that have had similar stories, like horror stories, send us an email, tell us what happened. Maybe we'll have them on the podcast just to get their story out there so more people can really understand that you're not doing a damn thing wrong. You have rights. You have rights as a patient. You can fire your doctor. You have to, like you said before, you must be your own advocate. And what do you say all the time? It's a practice. We're all learning. You know, yeah. And so reach out.
If you're not getting the answers and the treatment that you need, go above the doctor. Ask for the charge nurse, ask for the person to lead on the floor, whatever the case may be. Just keep going and going. And if you're not up to it and someone's with you, have them go be the runner for you and bring that person into the room and explain the situation, because you're there for your own health, and that's very important.
I do want to clarify, and we probably should have done this before. I was a former registered nurse. You're a health coach. We are just talking about our situations. We're not giving medical advice. This is more for entertainment. Right. This is our story, our experiences, to see who we can help as many people as possible. So I just want to say that disclaimer.
Yes, exactly. We're doing this to share information. We're not prescribing anything or recommending anything. You have to do what works for you with your own primary care provider or your specialist. But
Amen.
Stories, camaraderie helps, and people just like to know that they're not in this by themselves.
You're definitely not alone. Awesome.
Not alone. But hold on. I get out of focus.
Well, hold on. Since you've got your emotional support llama, here, I've got Namastasia. Our emotional support animals.
Right, exactly. Definitely.
You got to name him. You got to name your alpaca llama.
Okay. I will have a name by the time we do another show.
Yay. Yeah. All right, everyone. This was awesome. Sending blessings, good health. Have a fabulous, fabulous day, and we look forward to our next episode.
Yes, thank you for tuning in. We appreciate you. Share the information. Please share with your friends and family. Again, it's not all about dysautonomia. We want to help people with chronic illness as well. So we do appreciate you, and we hope you tune in to the next episode. Thank you.
Bye. God bless.
Bye.